September is Pain Awareness Month, and this morning we're talking about back pain. And I'm sure we've all experienced it at one time or another. And here with some ideas on reducing back pain is Dr. Samuel Holmes, a double board certified doctor in physical medicine and rehabilitation and pain management with Virginia Mason Franciscan Health. Thank you for being here.
Good morning. Thanks so much for having me. Really excited to be here.
We're excited because I have had some back pain issues, and I think I need all of your tips and information. So this is going to be good. Like I was saying, back pain so common. So what are some of the most common causes, would you say, of getting back pain?
I mean, you're exactly right. Back pain is really common. Most of us in our adult life are going to have back pain at least once in our adult life. And back pain, in fact, is the leading cause of disability worldwide. So it's real. Back pain can be anything as simple as some chronic aches all the way to this debilitating type pain. Fortunately, most back pain is self-limiting, meaning that it improves over time on its own. And that self-limiting type of back pain is generally related to maybe poor posture, maybe some overuse injuries or injuries associated with sports or accidents. And like I said, the good news is that over time that will improve. Now there are some things that you can do to help along the way.
That's what I was going to ask. What should I engage my core?
Yeah, well, yes, core strength is very important. You know, there was this old thinking that rest it out, bed rest, and that has not proven to be beneficial. So now we say, hey, let's avoid bed rest. Let's try to maintain our usual activities as much as possible. That core strengthening, that stretching, that range of motion can help out with that. Heating the affected and painful areas can help improve circulation in that area, help out with that pain. And then some over-the-counter medications like Tylenol in conjunction with anti-inflammatories like ibuprofen. Those type of things can help out as it gets better over time. Now, sometimes there are some symptoms that may be more concerning that may mean that you need to go get it evaluated with a healthcare professional. And some of those symptoms include if you have pain that is radiating or shooting down into the legs, if there's numbness or weakness in the legs, and obviously if there was bowel or bladder changes, that would really grab your attention. But in those type of situations, you really want to be evaluated by a healthcare provider so that we make sure nothing more serious is happening, something may be affecting the nerves in the spine. So that's another set of back pain. And then sometimes it doesn't get better over time, and it can become chronic low back pain or back pain. And when we're talking about that, we're generally speaking of back pain that's persisted past 3 months. And that can be a tricky situation as well because it's lasting a while now. Fortunately, VMFH, Virginia Mason Franciscan Health, has a team of experts and specialists that can help out in any one of those type of situations we just talked about.
Is there non-surgical options then, or surgery sometimes needed?
So absolutely. At VMFH, we are very lucky to have the absolute best spine surgeons on the planet, but surgery does have some risks associated with it. So we need to be careful with that. We have a really great spine and pain team across the Puget Sound that works really closely together to help identify those patients that may be appropriate for spine surgery and optimize their care before, during, and after surgery so that we can reduce those risks as much as possible. The great news is that surgery is not really necessary for most of back pain. And there, in fact, are a lot of really good non-surgical treatment options for low back pain. The best treatment strategies generally employ a multidisciplinary approach where there are multiple different specialists and experts that are working with the patient to help out in any way that we can. Things like my specialty, pain management, neurology, physical medicine and rehab, physical therapy, occupational therapy. That multidisciplinary approach can really be the best benefit for our patients.
Yeah, and so you touched on this, but best strategies that you can think of available to help patients with the chronic pain?
So that's where multidisciplinary really comes into play. We've got that graphic up, and so in addition to those other specialties that I mentioned with multidisciplinary care, you know, in chronic pain, because that pain has been around for a long time, it really takes time and teamwork to identify the multiple sources involved and at play and unwind the effects of that chronic pain. So that's really where the strength of multidisciplinary treatment comes into play. And so, I mentioned neurology and PM&R and my specialty pain management. Physical therapy and occupational therapy are really important to work in movement strategies and restoring function. Interestingly, health psychology and rehab psychology is important because chronic pain starts affecting emotions. So addressing those impacts of emotions in chronic pain become really important. And then there's really good evidence for things such as chiropractic treatment, yoga, acupuncture, medical massage. These are all things that can really help out with that chronic pain presentation. And the evidence really supports that coming at it from those different angles is really important. It really becomes an all hands on deck scenario. If there's something that our patients can benefit from, we're going to explore that with our patients. All hands on deck.
All hands on deck. I like it. Thank you so much, Doctor. I appreciate it. And to learn more about what we discussed today with Virginia Mason Franciscan Health, just visit the website that you see right there on your screen. New Day Northwest is sponsored by Virginia Mason Franciscan Health.